Namaste friends, my name is Ritesh and I have designed a course specially for yoga teachers and yoga practitioners, that is yoga anatomy and therapy for the musculoskeletal system. So we'll be focusing on the asanas or different exercises that will help in the disorders. So friends, first and foremost we will talk about the anatomical terms. What is that? The directional terms. We have the proximal, distal, anterior, posterior, and understanding why these terms are important. Anatomical planes, that is your sagittal, frontal, transverse. Then we go with body movements, that is flexion, extension, abduction and adduction. Once we understand this with practice, then we will go with the skeletal system. We'll talk about the functions, the bone anatomy, the axial and appendicular, the skull, the spine, the cervical, thoracic and lumbar, going in a little bit more detail, especially on the vertebral, the intervertebral disc, what are pelvic tilts and why it is important, the ischial tuberosity alignment, the feet that affects the misalignment, foundation, the dominoes effect, everything. We'll also talk about the human skeletal variations and how that will affect the yogic asanas or the way you see the asanas. Skeletal disorders such as osteopenia, osteoporosis, bone marrow disorders and leukemia. Arthritis, especially the rheumatoid arthritis and osteoarthritis, also known as RA and OA. Once we go through all these things, we will have a quiz at the end. Then we will go with muscular, that is muscles, basic, that is a type of muscles, what is agonist and antagonist, primary, the synergist and the secondary. Then we will talk about the types of stretching, the cause and effect. So what happens when one muscle is tight or weak? And asanas to focus on stretching as well as strengthening. For the muscles, we'll try to understand what is insertion, origin and action. Muscle disorders such as forward head posture, Dowager's hump, kyphosis, lordosis, uneven hip, flat back, scoliosis, knock knees, bow legs, and how which muscle work on the knock knee and bow legs. The hyperextension of the knee, tilted head, back pain that is quite common. And what is this upper cross syndrome and lower cross syndrome? And we will also talk about the case study. So before you meet any student, you need to have a case study. So I'll give you an idea about the case study. That's it for this course. Take care, keep smiling. Namaste.